Hello. Have you ever wondered how anesthesia works? Why does it make people unconscious for a short period, but doesn't lead to death? If you're intrigued by this topic, let's explore it together in this video. First, let's go back in time a bit. Hundreds of years ago, performing surgery on the human body was extremely difficult and dangerous because knowledge of human physiology was limited. Surgical techniques were rudimentary, often involving nothing more than cutting with a knife, and keeping surgical wounds from becoming infected was a daunting challenge. In fact, the concept of infection was not well understood at the time. But even if these challenges could be overcome, there was still a crucial issue to address: how to prevent patients from feeling pain during surgery. Just imagine, even a small thorn prick in your foot can be quite painful, let alone major surgery. Without anesthesia, performing surgery on the human body was almost unimaginable. However, remarkably, many historical surgeries were conducted despite these difficulties. Can you guess how they managed to make patients pain-free? Well, the doctors of the time were quite creative. They used various methods to alleviate pain. Firstly, they would have patients drink alcohol or use opium to induce a state of intoxication. Sounds fascinating, doesn't it? However, they didn't stop there. Many doctors would numb the patient's limbs with ice packs to reduce sensation. Even more surprisingly, they sometimes resorted to hitting the patient's head with a wooden mallet to render them unconscious, or strangled the patient until they lost consciousness. It seems like these were the first forms of anesthesia in human history. These methods are sometimes effective, but there have also been cases where patients died. And it wasn't until 1846 that a dentist in Boston research discovered and introduced an incredibly miraculous anesthetic at the time called ether. Ether is a group of chemical compounds with a common structure of oxygen atoms linked to two alkali groups. Ether truly revolutionized surgery at that time, making it much more manageable. Countless lives were saved, and soon after, researchers discovered many other effective and safer anesthetics. Additionally, they developed local anesthetics, which only numbered a specific part of the body rather than inducing complete unconsciousness. Despite advancements in modern medicine, there is still no perfect anesthetic. Anesthesia, while safe when administered correctly, can sometimes lead to dangerous complications when misused. It weakens the body, particularly the respiratory and circulatory systems, blurring the lines between anesthesia and a deep slumber. Although anesthesia is generally safe today, there are still cases of death or paralysis, especially when overdosed. Today, there are various types of anesthetics and different administration methods. Some are inhaled, while others are injected. Due to the risks associated with anesthesia misuse, these drugs are not readily available on the market. You can only obtain them with a doctor's prescription. Interestingly, certain drugs used to facilitate criminal and illegal activities, such as sexual assault, and openly sold and advertised on the market. Many rape cases involve perpetrators using these drugs, and their availability remains a concerning issue. Law enforcement agencies should ideally be vigilant and take decisive action, but somehow these drugs continue to flood the market. So how does anesthesia actually work? Well, even today, scientists don't fully understand its mechanism. They have put forth two main hypotheses: pharmacological mechanism. According to this theory, the solubility of the drug in cell lipids is closely related to its anesthetic effect. It is believed that the drug's solubility in lipids stretches cell membranes and reacts with proteins inside the cells, altering nerve transmission in the brain and leading to a state of unconsciousness. Neurophysiological mechanism. This theory suggests that anesthetics affect synaptic vesicles, reducing the uptake of calcium ions, which in turn decreases the release of neurotransmitters. Reduced neurotransmitter release impairs signal transmission, affecting the central nervous system. The specific details of how anesthesia works are still being researched by scientists. When there are updates on this topic, I will be sure to share them with you. Thank you for watching the video. Goodbye, and see you next time.